everyone. So today our topic of discussion is the autonomic nervous system. We know that all the preganglionic fibers are cholinergic in nature. And when we discuss the postganglionic, they are parasympathetic, which are cholinergic, and sympathetic, which are adrenergic, except the sweat glands, which are cholinergic in nature. And the postganglionic fibers are absent in the adrenal gland. So autonomic nervous system is divided into sympathetic and the parasympathetic. So broadly we can divide it into preganglionic nerve fibers, the parasympathetic ganglia, and the postganglionic nerve fibers. So we'll discuss parasympathetic first. So in preganglionic nerve fibers we have the cranial nerves and the vertebral levels पे हम बात करेंगे. So cranial nerves, there are four which are involved in this parasympathetic, and they have preganglionic fibers, and those cranial four nerves are oculomotor, facial, glossopharyngeal, and vagus, and vertebral levels are from S2 to S4. Whereas parasympathetic ganglia are concerned, all the visual organs, they have their own parasympathetic ganglia. Now coming on to the sympathetic nervous system. It has preganglionic fibers, the sympathetic ganglia, and the postganglionic nerve fibers. So preganglionic nerve fibers, there are T1 to L2. Sympathetic ganglia has two ganglia, the prevertebral and the paravertebral. So we'll discuss the prevertebral first. There are three main ganglion, that ciliary ganglion, superior mesenteric ganglion, and the inferior mesenteric ganglion. Whereas the paravertebral, also known as the sympathetic trunk, they are paired and they're lying on each side of the spinal cord, and each chain has 22 ganglia. So in cervical there are 3 ganglia, thoracic 11, and the lumbar and sacral 4 each ganglia there. And then comes the postganglionic nerve fibers.